Motivation Monday here on Everyday Kentucky. I'm Amber Canoy, and Dr. Shelley Heath with Bluegrass Hearing Clinic is with us. Okay, so I'm curious as the why. What made you want to become an audiologist?
So I actually found out about audiology as a kiddo. I was diagnosed with hearing loss in my left ear around age 4.
Wow.
Lots and lots of ear infections, several ear surgeries. My mom likes to remind me that there's a few places in my medical records where I fought with the audiologist.
Oh no.
And refused to get a hearing test. But I had 4 stuffed bears. I had one named for my audiologist, one for my ear, nose, and throat doctor, and then one for each of the residents that did some of my surgeries.
Wow.
So I couldn't have been a total terror, right?
So what makes you motivated to come here to work every day?
My patients. I think, hearing loss can be incredibly stressful.
Yeah.
It's something that we talk about quite a bit because of my own experience. I really struggle. Even now at noisy restaurants, it's difficult to hear and understand. And that's something that I can talk about with my patients. Unfortunately, I'm not a candidate for a traditional hearing aid, but the majority of my patients are candidates, or at least the ones that we diagnose with hearing loss, are candidates for amplification, so we can recommend that as part of their treatment plan and make a huge difference in their quality of life.
Yeah, anytime anyone starts to realize they're having hearing loss, it can be kind of traumatic. Because you think you're missing out,
Sure.
right? But as a 4-year-old, you don't really know what's going on. I would think that probably would have impacted some of the speech, probably.
My parents talk about more so listening effort and listening fatigue. So school, my mom just talks about how tired I was at the end of the school day, how much more, if she was, I guess, counseled on how much more effort it would be for me to hear and to be able to do my homework and things like that. So we can talk about that now even with adults, having to focus extra hard to follow a conversation. That increased listening effort can make it really difficult. Whereas if you have normal hearing, you can just respond to the question, where do you want to eat out, or do you want to go get coffee, instead of having to figure out what the question is before you can answer it.
Yeah,
it's exhausting.
Yeah, you don't think about that, the extra energy. Your body is sometimes not, you don't even realize you're having to put it in, but you are, to be able to listen, understand, and be able to answer appropriately. All right, well, thank you for sharing your story.
Oh, thank you.
Join us again for Motivation Monday.